Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh and salam sejahtera. Yang berbahagia Mr. Chia Tak Wing, President of Third Age Media Association TAMA and Chairman of Malaysian Coalitions on Aging MCOA. Yang berbahagia Professor Dr. April Camelia Rosiani, Dean of for the Faculty of Medicine, University Malaya. Our distinguished VIPs, delegates, ladies and gentlemen. Firstly, I would like to express my heartfelt thanks to the organizer, Yang berbahagia Mr. Chia Tak Wing, founder and president of Third Age Media Association TAMA, for organizing this conference in conjunction with the Second Asian Senior Care and Wellness Exhibitions or AGEXPO today. I'm honoured to be here and be part of this auspicious event. I applaud TAMA for organizing this conference, which reaches out to all levels of societies, including the civil societies, public and private sectors, and most important, members of the public of all ages, and not just limiting to seniors. This approach is more strategic because issues surrounding aging needs are holistic solutions involving an all-society intervention. I am pleased that TAMA is actively working in partners to enhance the needs and well-being of older Malaysians. The initiative to collaborate with University Malaya in their research project to develop caregiving, credentialing and music care module for caregivers is commendable. University Malaya has always been in the forefront in many initiatives and research to enhance the well-being of older persons, and this cooperation is timely. The signing of the MOU today marks an important milestone for both organizations and highlight the importance of close collaborations and cooperation between the academia and civil societies. My congratulations to both TAMA and University Malaya for setting a benchmark for others to follow. As Health Minister, I wish to highlight another area of concern affecting the older population. The incidence of non-communicable diseases or NCDs is on the rise in Malaysia. The increase in NCDs cases directly correlates to the increase in heart and coronary diseases, obesity, fatty liver and cancer in our country. These conditions are preventable, and as a nation, we need to take a stand to tackle this issue head on. Non-communicable diseases or NCDs and their complications pose a real and significant threat to Malaysia. NCD remain the largest contributor to premature mortality among older adults in Malaysia. Implementations of population-level NCD health promotion programs, screening programs among high-risk groups, and holistic intervention programs among populations living with NCDs are critical in reducing the overall burden of premature mortality, especially related to our four main types of NCDs: cardiovascular diseases, conditions and diseases of the heart and blood vessels, cancers, diabetes, and chronic respiratory diseases. NCD affects us in many ways. The disease costs the nation approximately Malaysia 8.91 billion or 0.65% of the national gross domestic products or GDP, based on a report by the Ministry of Health Malaysia, MOH, and WHO. Second, it overwhelms and burdens our healthcare system despite Malaysia having taken strides in better health access. And third, it sadly lowers the quality of our lives. In Malaysia, the prevalence of NCDs among seniors is high. According to National Health and Mobility Survey conducted in 2019, 76.5% of Malaysians aged 60 years and above have at least one NCD. Among them, hypertension is the most common NCD. About 2 out of 5 older people in Malaysia aged more than 60 years have been diagnosed with hypertension, with the highest prevalence, 65% among those aged 70 and above. This is followed by diabetes, 33.5%, and obesity, 20.5%. These statistics are alarming and require our immediate attention. The pandemic has worsened the situation as many Malaysians have adopted a sedentary and unhealthy lifestyles due to prolonged periods of lockdowns and movement restrictions. According to numerous studies, there has been an increase in heart disease, coronary disease, obesity, fatty liver, and cancer due to unhealthy eating habit, lack of physical activity, and stress during the pandemic. This is cause for concern as it could lead to a surge in NCD-related death in the future. Hence, Health screening and regular health checks are crucial, especially for seniors. In fact, many NCDs are preventable if detected early. Regular health checks can identify potential health problems before they become serious, and it can also help people manage their conditions better. The Malaysian government has been actively promoting health screening and regular health checks among Malaysians. However, more needs to be done to raise awareness among the public and encourage people to take responsibility for their own health, as well as it takes two to tango. We at the Health Ministry would like to work with civil societies, organizations and NGOs to create awareness of this potentially dangerous disease and to stem its rise. It is crucial for seniors to undergo health screening and regular health checks to detect NCDs early. Early detections of NCDs can prevent complications and improve treatment outcome. The government has taken steps to promote health screening among seniors by providing subsidies for healthcare screening packages and organizing health screening campaigns in various communities. However, more needs to be done to ensure that all seniors are screened regularly, which we will work together. The Ministry will also allocate more funds for preventive healthcare and improving the lifestyle of our people, and we need to increase public awareness about the importance of healthy eating habits, physical activities, and stress management. The government will also do its part by investing in infrastructure and facilities that promote physical activities such as parks, walking trails, bicycle lanes, highlighted by our Prime Minister recently. In conclusion, we all need to take care of ourselves, and the pandemic has worsened the situation, and we need to take action to prevent NCD and related death in the future. Regular health screening, promoting healthy lifestyle habits, and increasing funds for preventive healthcare are the steps that need to be taken to combat this issue. Let us all work together to build towards healthier and productive Madani Malaysia.